Today, we will be learning about asthma. The air we breathe moves in through the mouth and down into the lungs. Lungs are full of tiny tubes. The air we breathe moves through these tubes. In people with asthma, the tubes become swollen and full of mucus. This means that less air can move through. Next, we will talk about the symptoms of asthma. Symptoms are what we feel in our bodies. Asthma can cause you to cough. It can also cause wheezing, which is a tight feeling in the chest. And it can make you feel like it's hard to catch your breath. Some things make asthma worse. Things that make asthma worse are called triggers. One common trigger is pollen. Flowers make pollen. Pollen can float in the air we breathe. Being sick can be a trigger. You already feel crummy, and your nose is making lots of mucus. Cigarette smoke is a big trigger. If adults smoke, make sure they don't do it near you. Cold air can be a trigger. It irritates the passages of your lungs. For some people, exercise is a trigger. When you exercise, your lungs are working harder. There are many medications for asthma. Some medications help prevent symptoms, meaning they make you have symptoms less often. These are called control medications. Some medications treat symptoms, meaning they are to be used if you are having symptoms right now. These are called rescue medications. Today we will learn about your rescue inhaler. Everyone should have a rescue inhaler they keep with them in case they have symptoms. You should use your inhaler with a spacer. Spacers help inhalers work better. Medication is sprayed into the spacer so you can breathe it deep into your lungs and it doesn't get stuck in your mouth. Now, Shannon will help us go over the steps for how to use an inhaler. First, remove the cap from the inhaler. Then, attach the inhaler to the spacer. Shake the inhaler up and down 4 to 5 times. Take a big breath in. Then breathe all the way out. Tilt your head back and place the mouthpiece in your mouth. Press the canister once and start to take a slow, deep breath in. This should take 3 or 4 seconds. Then hold your breath for about 10 seconds, or as long as you can. This will keep the medication in your lungs. And then you can breathe out. Sometimes your doctor will tell you to take 2 puffs of your inhaler. So let's go over these steps again. We've taken the cap off the inhaler and placed the inhaler in the spacer. Shake the inhaler up and down 4 to 5 times. Take a big breath in. Then breathe all the way out, tilt your head back, and place the mouthpiece in your mouth. Press the canister once and start to take a slow, deep breath in. This should take 3 or 4 seconds. Then hold your breath for about 10 seconds, or as long as you can. This will keep the medication in your lungs. And then you can breathe out. After you use your inhaler, you should start to feel like you can breathe more easily. The little tubes in your lungs will start to open up and let more air in. If you don't feel better after using 2 puffs of your inhaler, you should tell an adult and have them decide if you need to go to the doctor.